Telehealth is the delivery of healthcare services at a distance, so the healthcare provider is not physically present with the patient. Rather, the healthcare service is delivered virtually using technology. Despite the many advantages of telehealth, its uptake in Australia has been slow. So to better understand the uptake and adoption of telehealth, we've been researching healthcare providers' experiences of using telehealth. It's often assumed that clinicians can simply replicate the practices that they use in person when delivering their services through telehealth. However, our research shows that the virtual delivery of healthcare is experienced very differently by clinicians than in-person delivery. Importantly, our findings reveal that telehealth requires considerable adaptation work and the learning of new competencies by clinicians. Several of the clinicians involved in our research perceived that it was more difficult to build trust via telehealth. Not that it was impossible, rather it just took a lot more effort. Our research revealed a number of practices that help facilitate building trust in telehealth consultations. These include using an in-person meeting before a telehealth consultation, establishing a personal connection with the patient, for example by showing genuine interest in the patient beyond the particular medical condition, and adapting one's non-verbal behaviour to the virtual context, for example waving to replace the handshake, using bigger smiles or clearer facial expressions and gestures on screen. And also explicitly communicating one's expertise and role, as well as one's affiliation at the start of the consultation, rather than assuming that the patient has these details.
Further, with the use of video conferencing equipment, the clinician needs to be very careful about their eye contact with the patient, and that they have to have a greater understanding of their presence on screen so that they don't look like they're inattentive when they're writing down case notes for the patient.
Adopting telehealth can be facilitated through training and mentoring programs. It is helpful to take the time to understand the changes that will be required to existing work practices and routines. Managing expectations is important. It takes time, effort, and learning to adapt to telehealth. Investing in telehealth coordinators is important. They play a critical role in facilitating the implementation and adoption of telehealth.